tell you a story, Alan, since we started.
That's a good idea.
Have you noticed anything different about me today?
Well, your camera looks sharper, but
There we go. That's what it was.
did you clean the camera or something?
It did. Well, it's funny. So my brother, he's a family physician, so he's a techie too. So he watched I think at least part of the first podcast, and he says to me, "Josh, your camera's horrible. How could you possibly have your podcast go with that poor quality? Providers, organizations are going to think that if you can't get your camera right, how good could the product be?" So I was motivated to get you better quality picture here today. So there you go.
Yeah, no, it looks great. It looks fantastic now.
You.
You can really see you. So I can tell, like, when you're looking at the camera now, it really feels like you're looking into my soul when you talk, and I really appreciate that.
Yeah, I'm sure some of our millions of viewers were worried about how pale I was or how sickly I looked, but no, it was just the bad camera.
That's right. Yeah. What I do each episode, I have to clean my glasses beforehand.
Well, Alan, it sounds like there's some value in cleaning your glasses and caring for them.
And it almost seems like we've arrived to the topic of today's discussion just naturally, completely naturally. The first couple episodes, we talked about different models of care and different outcomes like readmissions. And we thought if we take a step back from all that, what was the incentive program, or what is the main reason or the main catalyst for these new models of care, and why are we really focused on outcomes like readmissions? And Josh and I were talking about this, and we realized, well, value-based care is kind of the main initiative behind both of these efforts and all of these efforts that we're talking about. And so we've already touched on the value part and the care part, and we decided let's combine those together and really talk about value-based care and how it relates to our industry, and also how does digital patient engagement kind of help with value-based care, and where can we go with digital patient engagement to progress value-based care and the initiative that's already put forth. Why don't we start there, Josh? What do you think about value-based care?
Well, can I just say two quick things on your fantastic intro? So number one, for the viewers, we didn't prepare the intro story, so that was pure improvisation that Al and I did. We're actually both pretty big fans of improv in general as an art form. So good work there, good teamwork there in the improv to get to segue to value-based care. Yeah, I mean, I think when I think about how value-based care came about in the first place, it helps to look back at how healthcare evolved prior to value-based care. So if you look back in history, let's say in the 1950s, kind of around there, healthcare delivery was starting to become something very I think centralized and more of a hospital clinic-based setting. And we were getting very good at different things. We were getting very good at things such as performing surgery, treating people when they were sick, acutely ill, heart attacks, etc., the common cold. And so one of the ways in which governments, insurers wanted to incentivize, providers to deliver enough care to patients was to actually have a reimbursement model that was fee for service, that paid doctors and providers more on how much stuff they did, right? So to meet demand in patient illnesses, they needed to make sure that doctors got paid per visit, per surgery, etc. And that made a lot of sense, in the early to mid 1900s, when most of healthcare really was sick care, right? Treat you when you're sick. And kind of as we got closer to I think the 70s and the 80s, and medicine got better, people started living longer, right? And so instead of healthcare costs being largely driven by just acutely sick patients, you had patients living to their 70s or 80s, and they were having to deal with chronic diseases, diabetes, heart failure, and other things. And so now, what should have happened probably in the 80s and 90s was changing the payment model to figure out how do you care for patients who have chronic diseases to prevent them from either getting the chronic disease in the first place, or catch an issue earlier before they got so sick they ended up in the ER or readmitted. But instead, Alan, what happened was we just kept the fee-for-service train going
Right.
all the way to the 2000s, basically. And it wasn't until legislation such as the Affordable Care Act or Obamacare came out about 10 years ago that we really started realizing, hey, the fee-for-service model is incredibly unsustainable. Incentives are misaligned. We got to change the way that we pay for healthcare so that we can get better healthcare delivery. And that's kind of the transition of value-based care.
Right. So this Obamacare Act came out, and basically the idea was, let's change the incentive model so that we can put it on things that would be a bit more valuable for patients and not really a fee-for-service model, because we have these new chronic conditions that patients are having to pay a ton of money to come back to the hospital or come back to the clinic. And so with this,
that's the patient too, right? It's the government, insurance companies, other payers. So and obviously patients end up contributing to those to having to cover those costs as well. So society as a whole is negatively impacted by that. Even we look at the U.S., lots of insurance is covered by employers, and so if your employees aren't healthy, that cuts into the cost of the business too, and affects the sustainability of many businesses.
So with value-based care, now this has become this umbrella term of value-based care. What does it entail? What is value-based care, and what are the differences from fee-for-service that have now been put in place?
Right. So in a fee-for-service world, providers get paid based on how much service you do. So you get paid for every additional patient you see, every additional procedure you perform, et cetera, et cetera. In a value-based care world, insurers or the government pays providers based on basically either how well patients do in terms of health outcomes, how satisfied they are in terms of patient satisfaction scores, and then how well they can control costs while maintaining quality. And so, Alan, for the first time, providers actually are incentivized to collaborate and work together and support a patient cohesively, because that's important if you want the patient to have the best health outcome. You have providers all of a sudden caring what happens to a patient outside the four walls of a clinic or hospital, because we know that 99% of a patient journey happens when you're not in front of your provider. So if you want to make sure a patient is healthy across their entire life, you have to somehow care and engage with them and keep them on track between all these visits as well. And so it's no longer about sick care, it's truly about healthcare.
Yeah, that's a great point. And so to enable this change, there were different reimbursement models and different incentive models that were put in place. I've heard of some of them, like the bundled payment program for hip and knee, and bundled payments for CABG and cardiac certain procedures. Do you know any other sort of incentive models that have been put into action?
Yes, I mean, we saw, shortly after the Affordable Care Act came out, CMS had several value-based funding programs. So very popular, well, I wouldn't say popular among health systems, but popular as in they're prevalent, were the, readmission reduction programs, where organizations were penalized for having high readmission rates for conditions such as heart failure or pneumonia or heart attacks. But also the value-based purchasing program, people might have heard of, where incentives are based on, can you keep mortality or complications across or below certain rates, or keeping patient satisfaction scores above certain rates. So there's a number of different programs that CMS has come out with, and insurers have done a lot of their own direct models with providers. So a lot of insurers also did bundled payments, and then actually, where we're from up here in Canada, we've started doing bundled payments in some parts of the country over the last couple of years, typically in orthopedics and cardiac care. So these models, I think, were largely driven progressively in the U.S., but have started to spread to other parts of the world.
Right. And I guess the goal for patients seems pretty obvious. It means potentially less visits to the clinic. You're getting better preventative care and better management of some of these chronic diseases. More personalized care. So we're now treating patients not like a number anymore, and they're more like, this is our patient. We need to follow up on their journey and make sure that they're getting the best care. better outcomes, presumably. If there's, readmissions penalties, we're going to have efforts put in place to reduce these readmissions, reduce even some of the other costs that are happening at the hospital level. Improve satisfaction. That's obviously a big one for the patient voice and the qualitative point of view. It sounds like, when we introduce all these new measures and these new data points that we need to be collecting, that there's maybe a lot of extra work now for the healthcare system, and there's more work for providers to have to collect all these different data points, and then also introduce new models of care like enhanced recovery. And we've done an episode on that, and we know how taxing that is on the system to have the actual workforce and the power to actually build a program like that sustainably. What else does it entail? So value-based care, what does that entail for providers, let's say?
Yeah, so you brought up a great one in terms of standardizing best practices such as enhanced recovery, which requires not just more work but collaborative efforts. So it means dealing with teaming up with folks that you otherwise maybe wouldn't have really formed teams with. But I think that's great progress for healthcare. It seems I think you'll find that with that sort of collaborative culture, outcomes just are generally better. I think another that we think about is if you look at a bundled payment, part of the way to succeed is to reduce your post-acute care costs, usually reducing, really unnecessary discharges to skilled nursing facilities or rehab, for patients who frankly could have recovered just as well as home. It's far more cost effective for them to be at home. It's probably safer from a certain point of view. I mean, frankly, Alan, during COVID-19, if you can safely get a patient discharged home, where the risk of COVID-19 is far less than a SNF or a rehab or a long-term care facility, that will certainly lead to a better outcome today. But how do you do that safely? And then, of course, there is some more work if providers have to give more data back to payers or the government to show, how they're kind of meeting targets in these reimbursement models. And so there might be new processes for collecting data. There might be new technologies needed. So they might have to either get new IT systems, switch EHRs, upgrade EHRs. So there's certainly a lot of investment that has to be made into it. But I do think that the shift to value-based care is inevitable. I think where there might be disagreement is on what are the right models for value-based care. So I think there's still a debate about some of the reimbursement models that have happened the last several years. So things such as readmission penalties or bundles. I think what we've seen in the data is that there might be certain conditions or surgeries where these models have actually led to benefit, and other conditions or surgeries where it hasn't. And so part of the work that's being done is figuring out, okay, what is the right model for value-based care for different patient populations or conditions
Right.
or surgeries, but that's part of the iterative process, and I think that's fair.
Right. And I'm just curious, but the demographic information must also factor into the readmission penalties, because a readmission in California versus a readmission in Michigan is going to be completely different based on their demographics.
Absolutely. So typically they're doing risk adjustments on the targets for things like readmissions. But one quick thing I did want to share on the topic of iteration. So if you look at the history of bundled payments, for example, a lot of people who are new to bundled payments think that it's this new phenomenon that just happened in the last couple of years in the U.S. healthcare system. But if you look at the history of bundled payments, it actually started, way back in the 90s. And I think it was government initiated, but they started testing different models of bundled payments. So there were models where I think they only looked at bundling the inpatient episode, and there were models where they looked at only doing a bundle for the post-discharge 90 days. And then I think most now have a combined in-hospital and post-discharge 90-day bundle. And the reason that happened was that they found when you only had kind of part of that bundle covered, there were misaligned incentives. So for example, if you only bundled the inpatient part of the episode, then organizations were incentivized to discharge patients ASAP. Exactly. And then you have those higher readmission rates or mortality rates. But then when they only bundled the post-discharge side of things, then people were taking probably way too long on the inpatient side and just keeping patients in longer than they need to, even maybe unnecessarily increasing length of stay to drive
Right.
more revenue, whatever the reason was. And then, maybe the patient, could have left sooner. And so, it took years for them to iterate that process. And I think that's okay. So I think what's important is getting aligned around, okay, conceptually tying reimbursement to outcomes so that we're getting the best bang for our buck basically in healthcare
Right.
makes sense. And then it's about, okay, let's then iterate the reimbursement model so that the logistics of value-based care makes sense. But I think people have to at least be on board with conceptually that value-based care is advantageous over fee-for-service in the long run.
Right. And I know, from a patient perspective, it seems like that's the right move. It seems like, as a patient, if I were going to the hospital for a procedure, I would want the care that's personalized to myself and treats me like a person and a human being. And that's why I think some of these programs, like with value-based care that I've seen, and the requirement for the patient voice and collecting patient satisfaction and showing that the satisfaction is actually improving as well, is I think kind of that next component to value-based care, but even specifically to a bundled payment program. And it's now requiring us to collect the different patient-reported outcomes for different validated surveys. So I know with the CJR bundles, for instance, there's the Who's and Coos surveys that we need to now collect, and that has obviously information directly from the patient. But with that, we obviously need new technology, or we need to hire someone to actually talk to these patients and collect this information from them. Traditionally, how was that being done? Was it actually, let's go hire someone? We have extra nurses maybe, and they would be calling patients each day, or what were some of the limitations with, when they invented the need for Who's and Coos and validated surveys for patient-reported outcomes?
Yeah, so I think initially it was probably done on paper and usually the waiting room, or maybe you mailed the surveys to patients. I think at some point it may have transitioned to phone calls,
Right.
um, because I think from the Cahoos or Coos, you have to do it, once leading up to the surgery, and then several times in the first year after the surgery. And then if you require the patient to come visit you, 6 months after surgery to fill out the survey, then they might not come back 6 months from now, right? So paper, then telephone. But to your point, that's kind of unwieldy. Patients don't always pick up the phone. It takes time for someone out of their day, like a nurse or an analyst, to call all those patients and collect that data.
Mhm.
It's not the most convenient for a patient either to sit through, a 20, 30-minute call to get through this. So I think at some point there was an evolution to, okay, let's do this digitally. So, there's been a lot of good patient-reported outcome solutions out there. I think typically through something as simple as an email or a
Mhm.
web-based data collection method. But I think kind of one of the limitations of patient-reported outcomes has been that they've been very um, episodic in terms of having very few time points.
Mhm.
So it's great that you can collect something once before a surgery and then 3 times after the surgery, but
Right.
there's so much granularity in between all those time points about the patient experience that aren't well captured by the current tools. And so, one of the unique opportunities with digital patient engagement and the idea of engaging the patient, daily throughout the entire journey, is that you can collect like really rich patient reported outcomes across the entire journey, and get more granular. And so I think one of the things that we're going to see in value-based care in the future is not just, hey, let's tie reimbursement to, can you collect 3 data points about a patient reported outcome. It's going to be, hey, can you collect, tens or hundreds of data points across that
Mhm.
journey, so that way, we can build a more granular picture of the patient experience, and have a more granular picture of value-based care from a patient self-reported point of view. And actually, going back to one of your previous points about, how do you capture value from a patient point of view? I think I
Mhm.
think I think it's been good that we see PROs being part of that discussion now, even though they're still a very small part, I think, of
Mhm.
value-based care and value-based reimbursement. Because if you ask a patient, you know, what's what's value to them in a healthcare experience. Let's be honest, a patient often won't say, "Oh, um, I want I want the complication rate for infections to be at less than 1%." Right?
Right.
They're not saying stuff like that, right? So a lot of things that we collect as from healthcare's point of view as a provider for outcomes to show value is not necessarily what a patient cares about. A patient might care more about if I'm a 75-year-old person having my knee replaced, I might care more about what's my pain going to be a year from now because I want to walk my daughter down the aisle at her wedding, right?
Right.
And so I think we're seeing people realize that you have to bring the patient voice into the value-based care conversation, especially because healthcare is becoming more consumerized.
Mhm.
And so I think digital can play a significant role in helping us bring that voice into the value-based care conversation.
Right. And so I guess it's typical, as an organization, let's look internally first and see what technologies are available to reach our patients. And, with different patient portals that exist today, that seem to be the quick and easy solution. Let's, set up a quick survey through our patient portal. But as Josh, you and I know, patient portals have fairly low adoption rates that we hear all the time from our healthcare providers. And so obviously, calling the patients each day is not scalable to get that information. So we do need some other type of technology in there to help us get this data, especially if we're having to now report all these next points to our insurers and to the government. So how does a digital patient engagement platform like SeamlessMD, how does that support value-based care?
Yeah, so I think it goes back to, we're asking, value-based care is asking providers and healthcare organizations, hey, I want you to do all the things you're originally doing. So, seeing patients, doing, surgeries, procedures, managing chronic conditions. I want you to do all the same things you were doing. But by the way, I'm going to make you take on more financial risk. And I want you to do what you were doing, not just in the hospital, in the clinic, but by the way, can you also do all these other services to keep the patient healthy in between these visits, keep them healthy before and after their surgery, optimize them across the journey? And as a provider, you're saying, oh my gosh, now I'm just trying to stay afloat with this new reimbursement model, but you also want me to do all these extra things. And as a provider, you think to yourself, okay, well, if I want to keep the patient, let's say, on track before or after their surgery, keep them on track with their protocol, make sure they're preparing and recovering properly, ideally, I would be talking to a patient every day, all day long. I'd be reminding them to follow their steps. I'd be calling them to ask them to report their pain levels every day. But you can't do that, right?
Right.
There's not enough people in the world for them to simply do that. And that's the exciting thing about digital engagement, right? What we do is we're basically saying, hey, we can actually automate all those interactions at scale. We will use technology to remind a patient to do their recovery steps. We're going to prompt them to tell us their pain or their temperature, or take a photo of their incision, and then we're going to automate as much of that, and then escalate issues back to your nurse or your care team.
Right.
And so we're kind of allowing them to deliver truly optimal care and deliver all the interactions they would ideally want to have, but actually do it in a scalable way. And also in a way that patients, frankly, are increasingly expecting to be reached, right? There's more and more data showing that every year, patients as consumers want more digital access to healthcare delivery. They
Mhm.
want to be monitored. They want to be, reporting their symptoms through digital. They don't want to have to come in every time to tell the doctor or nurse how they're feeling.
Right. And I think the immediate criticism to digital technology like that is, how can that be a personalized care? How can that be really treating the patient like a human and not just a number? If it's, maybe they're a diabetic or a smoker, and are you just going to send that information to everyone and they have to sift through it themselves to figure out, like, choose your own adventure? Am I this patient or am I this patient? I think that's an early criticism that digital technology gets, but we have to remember, it's the year 2020. There's a lot of improvements in digital technology now, and it's scalable quite quickly. So we're now able to provide that personalized care. So that diabetic patient gets information about, managing their blood sugars and so on and so forth. So we're now able to leverage the personalization efforts of technology to reach the patient with the right instructions at the right time, provide the right care at the right time, and like you mentioned earlier, track the patient daily and be that kind of safety net for the patient, where they can actually report what's going on and have the satisfaction knowing that somebody at the care team or at the hospital is looking after them and is really going to be monitoring the patient.
Yeah, here's the thing, Alan, right? So without digital technology, and let's say you're on the hook for potential readmission penalties. Normally, if you're a provider, you would say, okay, I guess we'd have to call the patient every day to see how they're doing, and hopefully, and then document all those symptoms every day, identify trends manually in a spreadsheet, and try to catch something before it becomes a
Right.
readmission.
Let's
Or
repurpose our nurse to do that role as well now.
right, because our nurses all the time in the world to call
Yeah,
patients
exactly.
24/7. Or you give them something like SeamlessMD, where you get patients prompted automatically to track their symptoms, take a photo of their incision if it's looking strange, and then just alert the care team for patients who are off track, and then just look at the data remotely and call the top 5% of patients who are having an issue. Um, it makes sense to do that. And to your point earlier about delivering more personalized care to optimize the patient's outcome using digital technology. I mean, one way to look at it is the shift from you know paper and verbal and manual patient care to digital engagement is very similar in my mind to the shift from um, I mean, sort of Blockbuster to Netflix. And it's not, it doesn't mean those brands, but in the old days with like a Blockbuster, I'm I'm a consumer. I have to look at all these titles, right, in a store, even on a website, and they're not really customized to me. I get everything. 90% I don't really care about. I have to sift through stuff, right? But in today's world, where Netflix has all the understanding of your profile and what they know you are most interested in, everything's going to be customized for you, right? Or if I go on Amazon, it knows like what my interests are, what I want to buy as a consumer. From a healthcare delivery point of view, as we something like SeamlessMD, digital engagement, by knowing the patient's medical history and comorbidities and risk factors, the program can be tailored, right? The patient shouldn't have to read 50 pages about diabetes if they're not diabetic, right? They should get timely, relevant instructions and care for them. And so technology allows us to deliver that personalization, which gets better patient engagement and better outcomes.
Mhm. And even back to one of your earlier points about, maybe there's a 70-year-old man going in for a hip replacement, and his real concern is he wants to be able to, have lower pain in a year and actually walk at his daughter's graduation or his granddaughter's graduation. That's even an element of personalization that is incorporated into SeamlessMD, where they can personalize it around the goals that they actually have, and they can be their own formulated goals. It doesn't have to be, let's make sure our SSI rate is below a certain threshold, but it can actually be a very personal to the patient kind of goal.
Yeah, and it tells the patient, hey, my care team cares about the same day-to-day things I care about. It shows that my care team cares about that. Yes, the pain matters to me.
Right.
Reducing stiffness in my joint matters to me. How far I can bend it matters to me. It's nice for patients to know that providers are also valuing the day-to-day things that the patient cares about, not
Right.
just, as you mentioned, the complication rate or all the more clinical things.
Exactly. So when value-based care and these initiatives come forward, there's obviously a lot of new challenges for providers. So, a couple of them are standardizing the actual, what is the best practice patient care that we can give. We need to standardize that. We need to figure out a way to actually support our patients throughout the journey to ensure that they're, not in the hospital longer than they need to be, and to make sure they're not coming back to the hospital unnecessarily. And maybe there's ways that we can catch complications early. So there's all these new ideas that providers and the healthcare system needs to think about and has to solve. On top of that, we're now having to collect information from patients, or more information from patients, around their journey and their reported outcomes plus satisfaction. And of course, we have to keep, top of mind, we need to improve our outcomes. And all of these kind of challenges put together is kind of the big puzzle to value-based care that we need to solve. And so providers are now looking towards digital technology because we've recognized, okay, it's not scalable to repurpose my nurse to do all these calls and get this information. So as we look towards technology, how does SeamlessMD kind of fit in to solve each one of these pieces? And does it solve any of these pieces?
Yeah, so I mean, all of them. And so we can probably go on a long time about each of these, but I think one that I'll point out is, one of the challenges in healthcare organizations is that teams are constantly changing. So unlike our business, Alan, where every day you're working with the same team, right? For the most part, in an organization, every day, who's on shift changes, right? So at any point in time on let's say the cardiac surgery floor, the surgeon on staff, the nurse on staff, the physiotherapists, occupational therapists, pharmacists, and other staff, they can rotate. If you're in an academic center where you have trainees such as residents and medical students, they're changing every couple of weeks. So one of the challenges of the healthcare environment is that the teams are constantly changing. And so when you're talking about delivering standardized care, best practice care, one of the problems you run into is the fact that, okay, it's great if the team today has agreed on and is bought into and knows the standardized practices to deliver every patient. But the moment a new person comes in or leaves or changes, there's a lot of overhead in kind of bring them up to speed. And it's not uncommon that you implement something like enhanced recovery and it seems to be working, but you just get one new staff member joining, rotating in, and patients are hearing something different from that staff member than what's in the protocol. And so one of the ways in which our partners have used SeamlessMD is to say, okay, SeamlessMD is a digital standardized platform and vehicle where all of our patient-oriented protocols such as enhanced recovery are on there, right? And what that means is it doesn't matter if the staff changes. The protocol is the same. The patients will get consistent information from Seamless as a central repository of that information. And so it allows them to actually be consistent with the protocols for patients. And in fact, one of the interesting things that we find is that as part of the patient-reported outcomes we collect on feedback, patients are actually using Seamless to tell their providers when they're starting to find that information from providers is deviating from the standardized practice. So actually they're starting to see, okay, patients are saying that so-and-so staff member told me something different from the protocol. That gives an indication to the healthcare team that people aren't aware of the standardized practice and they have to re-educate. The other thing that's interesting is that if you're in a very large organization, so let's say you're a multi-hospital system and you're trying to roll out a standardized practice such as enhanced recovery for let's say cardiac surgery across 5 different hospitals. Well, having a centralized digital platform such as SeamlessMD, so that you can ensure that all 5 facilities are delivering best practice pathways, and also if you ever change the pathway, that can be updated on one platform for all of your patients. Exactly. That's one of the advantages of technology. You can make these changes at scale instead of having to necessarily update every single, brochure, pamphlet, protocol in every single facility. And if you think about some very large organizations with dozens or hundreds of facilities, going digital for standardized patient care is going to be critical for reducing that variation that definitely exists when you're at that kind of scale.
Right. And then obviously, SeamlessMD has been proved many, many times to improve outcomes like length of stay and readmissions. And we could get into how that actually does it, but that might be, we'll save that for another time, perhaps. But the kind of one of the neat findings that I heard from SeamlessMD is, around physician well-being and provider well-being. As they have to now do all these extra tasks and they have to collect all this data and they have to report it back and they have to pull data from the EHR and run all these spreadsheets it's a nightmare. There's a ton of extra work on a ton of extra admin work on top of their day-to-day practice. And so one of the neat findings that I've seen with SeamlessMD is the ability to make the provider's well-being a lot stronger. So reducing phone calls to the clinic that are maybe the common questions that patients are calling in about after they've left the hospital. All of those have been reduced, and reducing even unnecessary visits to the hospital. We can now promote, more virtual care and can chat with the patient over the technology, and so there's just a ton of advantages that aren't even outcome related. And then of course, patient satisfaction. We get comments from patients all the time that are saying, they had less anxiety with the platform. They feel more connected to the care team. Even their family is engaged on the platform. So there's the ability to enroll a caregiver on SeamlessMD. And so you might have, your son or your daughter or someone that's in the family that maybe doesn't even live in the same city as you. Maybe they're in a different state altogether, but they can now engage along with the protocols and see how, their father or mother is doing on the platform. So I think all of these together is kind of the ways that SeamlessMD is helping with value-based care from a qualitative standpoint. And then quantitatively, of course, there's the length of stay reductions, readmissions, the discharge to a skilled nursing facility that has been reduced as well. Do you have any thoughts on?
Yeah, and I think you touched on a good point with on the better provider well-being, but also satisfaction. So, without value-based care, right, we think about patient satisfaction as just, what are you doing to make patients happier when they're in front of you, right? So in the hospital, how do you drive up patient satisfaction? Well, I think some organizations have found data showing that if you make movies available on the TV screen in the patient room or give them better TVs, that's driven up patient satisfaction scores. Okay, that's great. That has nothing really to do with their health, but I'm glad it's getting you better scores. But in a value-based care environment where you have to actually care about what happens to patients outside the four walls, okay, how do you drive up satisfaction between visits?
Right.
And so I think what we've seen with digital platforms like Seamless is what you've mentioned. By actually engaging patients between visits and answering preempting their questions with answers just in time, it's driven up that satisfaction. As you said, it's reduced anxiety. It's kept families more engaged. So it's been a great vehicle to actually improve satisfaction between visits, which I think will be increasingly important long term. And then the second point on that you had on provider well-being, we've seen some really great results in preventing calls and visits. So for those who aren't familiar, one of the things that Seamless does is we prompt patients to let us know if they're having certain issues we know are common to that condition. So, for example, if there's certain surgeries where a patient's likely to have constipation afterwards, we actually ask them, hey, do you have any of these signs of constipation? And if there are some low risk, constipation issues, we automatically push them content on here's how you manage constipation, here's how you prevent constipation. And these are things that patients would normally have called in about, right. Call their surgeon, their doctor, their nurse, but now they're not. And so, for example, one of our partners, WashU out of St. Louis, we're doing work there led by Dr. Jeffrey Blatnik with the hernia program, and they did an evaluation where they saw a statistically significant, 65% reduction in phone calls from patients. And I think largely because we're preempting a lot of these common questions. Over with Michael Garron Hospital and Carmine Simone, and who's the chief of surgery there, they did some work in thoracics with us where they saw dramatic reductions in ER visits for non-urgent issues, things such as patients with chest tube blockages were being prompted on Seamless to just call into the clinic and get those resolved and not go to the ER. Mm-hmm. And these are simple things, but it's about getting that right information to the patient at the right time at scale. And that's better for providers too, because providers don't want to see patients in the ER for non-urgent things, right? They want patients healthy, recovering at home, coming to the clinic if needed. And I think, Alan, again, especially during COVID-19, value-based care is going to be very much about how do you get great patient outcomes, but how do you do that in a way that keeps patients safe and healthy at home as much as possible? And so that's going to mean more digital care, more remote care safely. And by the way, when I talk to healthcare organizations, no one thinks that we're going back to the old way of doing things. The
Right.
changes that are happening because of COVID-19 are going to stay indefinitely. No one's going to go backwards now. And so more than ever, safe digital remote care is going to be not only imperative for value-based care, it's going to be expected as well from a patient experience point of view.
Right. Yeah, absolutely. And so value-based care makes sense. It's here to stay. They're going to keep iterating on what the actual measures are and what the actual programs are that are in place, and that's based on real-world feedback and seeing how does it work with patients. I know some of the early points of contention that I hear about is the reporting standpoint. So it's there's time delays. We have to get all this data back from, let's say, our EHR, and that may take a month to 3 months to finally consolidate this data from our patients, and then we have to send it over to the insurers, and so there's definitely a big time delay there. And so I think that's another aspect where digital patient engagement, because it is real time and because it's collecting information in real time, and in the case of SeamlessMD, where it is a validated platform that's integrated and has formal integration partnerships with both like Epic and Cerner, for instance, that makes the transition so much easier because we're getting this information in real time. We can put it into Epic where the rest of our data is stored, and then we can export all of it together, presumably in real time, or at least the patient side in real time. So I think that's another reason why this technology is so important moving forward with value-based care.
Absolutely, totally agree with you.
I know we could dig into other topics like, how does SeamlessMD actually impact length of stay? And there are different, ways that happens. It's not just the compliance with protocols, but it's also confidence for patients and providers sending them home with the technology. We could get into readmissions, but it's pretty self-explanatory how that works. And even SNF discharge, I know you touched on it already, but patients are probably going to do better recovering at home if they can. So that makes sense. So we could dive into these topics, but I think maybe we'll save that for another time. I think I wanted to really focus on value-based care for this one, and I think we've done it justice from a digital patient engagement standpoint.
Well, Alan, you're the boss. You're calling the shots. So
I'm calling it there. I think it was.
If that's all, folks, that's all, folks.
That's all, folks. That's great. I will put one last recommendation, because Josh mentioned at the start of the episode we're big on improv, and you did bring up Amazon already, and we're not a paid sponsor of Amazon, but I felt I should do the world justice. There's a new improv show on Amazon called LOL, or Last One Laughing.
I haven't heard of that.
Everybody should go and check that out. It's one of the best shows that's on Amazon right now. Has nothing to do with value-based care, but
it could.
But it could. It absolutely could. It could improve your satisfaction and definitely provide some value in your life. But
let's be clear. If Jeff Bezos wanted us to be a sponsor for Amazon, we're open to discussions there.
We're open to discussions. I think that's probably the best answer we can give. Well, awesome. Dr. Josh Liu, thank you so much for this topic. Value-based care is another one in the books, and I think it's something that's going to progress over time, and so we'll probably have other episodes related to the topic in the future as well.
Sounds good. Thanks so much, Alan. Have a good one.
Have a good one. Bye.